This video was produced to prepare patients with low back pain for the interviews on stratified care in Nigeria. It is a collaboratory effort from the Trier University of Applied Science, Germany, the University of Lübeck, Germany, and the Obafemi Awolowo University, Nigeria. The Start Back approach in this video was developed in the School of Medicine, Keele University, UK. This video was designed to give an overview of the low back pain, describe challenges with the current approach and why a new approach is needed, introduce the Start Back approach, and outline the outcome of the approach from research. To begin, let's talk about low back pain. It is pain felt on the lower back, sometimes extending down to the legs. It can be mild or sometimes very severe. Most cases of low back pain are not caused by something serious or anything at all. They can be referred to as non-specific low back pain. Yet, it can be so painful that sufferers can have disturbing thoughts. These thoughts in themselves worsen pain and disability. Such thoughts as, I think something serious is wrong with my back. Maybe something is broken. I should avoid any activity that triggers the pain or any activity at all. My pain might never get better. Research shows that such negative thoughts can worsen pain and prevent patients from getting better despite treatment. Current approach to treatment has some challenges. One, it is based on intuition. We know that intuition is not 100% reliable all the time. It also uses diagnosis. Since most cases are without specific cause, money is wasted in endless search for the cause of the back pain. All patients are given similar treatment, one-size-fits-all approach. From research, not all patients need physiotherapy. And finally, current approach encourages passivity, saying that one can get better by more treatments. This leads to over-dependence on physiotherapy and reduces patients' active participation in their treatment. The Start Back approach is based on the transition from treating all patients the same way to subgrouping based on complexity of condition and targeting treatments to these subgroups. In the Start Back approach, the grouping is done based on likelihood of poor outcome regardless of the number of treatments one receives, and targeting current best treatment to these subgroups. The subgrouping is done using a tool called the Start Back questionnaire. This tool is used to group patients into 3 categories. The low complexity, patients who will do well with little or no intervention. Medium complexity, with average to moderate likelihood of poor treatment outcome. These patients have lesser physical and psychological components of pain. And the high complexity, with high likelihood of poor treatment outcome. These patients need more care due to the presence of physical and psychological components of pain. In the Start Back approach, all individuals with varying forms of low back pain are first screened using the tool into subgroups. The Start Back score determines the category. Depending on the subgroup an individual falls into, there are matched treatment recommended. Patients are matched with treatment based on these recommendations. For low complexity, advice and pain medication. Medium complexity, physiotherapy and self-management. For high complexity, physical and psychological approach. The questionnaire used in screening was developed in the UK. It consists of 9 questions. Question 1 to 4 asks the kind of pain and disability the patient experiences. Question 5 to 9 talks about the psychological factors affecting that pain. The questionnaire is simple and short, and it can be filled in a waiting room within 1 minute. With this, the clinician quickly identifies what treatment the patient will best benefit from and give the best result. In this approach, all patients will receive an initial assessment with physical and psychological examination. Additionally, for patients who fall under low complexity subgroup, the approach will involve one appointment in which the clinician takes a close look at the back and addresses patients' specific concerns. It also involves giving patients advice on how to care for their back in order to reduce pain and disability, and what to do if the back pain reoccurs. Patients will then be discharged with or without medication. Under the medium complexity subgroup, in addition to the treatment for low complexity, the approach will involve physiotherapy care for 30 minutes for about 6 sections within 3 months. And for high complexity cases, in addition to the treatment given for low complexity, the approach will involve 45 minutes of physiotherapy for 6 sessions over 3 months. The clinician will also take care to investigate the patient thoroughly, physically and psychologically. When unhelpful beliefs and negative thoughts are discovered, they are addressed using enhanced communication skills to combat negative emotions, unhelpful beliefs and expectations. Activities and specialized techniques will also be used to remove anxiety and fear of activity, and physiotherapy to further reduce pain and disability. This approach has been carried out in the UK. 2 research works show that patient disability reduced, they could carry out more activities, they took less time off work, their quality of life improved, and they were more satisfied with their treatment. In addition, regarding categories, patients in the low complexity subgroup, being the majority of cases, spent less, and patients in the high complexity subgroup received more care than before. Regarding cost savings, the use of this approach resulted in the saving of about £34. This was due to the use of less medications, less referrals, less tests, and others. In summary, the StartBack approach uses the StartBack questionnaire and its matched treatments. Patients with non-specific low back pain are grouped based on complexity into 3 subgroups. All patients are thoroughly assessed and examined before the target treatment begins. 2 research works show that this approach improves patient outcome and saves costs.